Welcome back to the Gut 360 podcast, your weekly dose of Monday morning inspiration to help you take back control of your health and transform your mind, body, and gut. I'm your host, Ellie Breacher, a registered nutritionist, and I can't believe this is the final episode of season 3 of the podcast. Today, we're unpacking a topic that so many women want clear, evidence-based answers on, and that is fertility. And I'm joined by an incredible guest, Dr. Natalie Crawford. We're diving into what inflammation and insulin resistance mean for fertility, why PCOS is so often misunderstood, what trimester 0 really is, whether egg freezing is worth considering, and the lifestyle factors that genuinely move the needle when you're trying to conceive. We also talk about male fertility, environmental toxins, sleep, stress, and how fertility can often reflect your wider health picture. So if you're thinking about your future fertility, one day you plan to start a family, or you're trying to conceive now, or just want to understand your body better, this conversation is packed with insights, so grab a matcha and let's get into it. Dr. Natalie Crawford is board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, and is co-founder of Fora Fertility, a boutique fertility practice in Austin, Texas. She's CEO and co-founder of Pinnacle, a professional network for women in medicine, and she's a digital health educator on social media, YouTube, and hosts the podcast As a Woman, which, by the way, I'm a huge fan of. And she recently released her debut book, The Fertility Formula. What an honor to have you here, Dr. Natalie.
Thank you so much for having me. I'm so thrilled to be able to sit with you today and talk.
Me too. I'm excited for this conversation. And I know that you're a fertility doctor who has also experienced your own infertility journey and pregnancy loss. So can you tell us your personal journey and how that shaped the way that you care for patients today?
Yeah, Ellie, that's a great question. And thank you for asking, because unfortunately, I know what it's like to be on, both sides of the table when it comes to infertility. We started trying for a family when I was in my last year of OBGYN training. So in the US, you go through medical school, and then it's 4 years of an OBGYN residency, and then 3 years after that of reproductive endocrinology fellowship. So it's a long training pathway. And at the end of residency, we decided it was time to start a family. And we started trying, and we started having recurrent pregnancy loss. So my first pregnancy loss I was very clinical about it. I remember telling my husband, 1 out of 4 pregnancies end in loss. It's not that big a deal. It was better. It worked out. Wasn't meant to be, said all the very scientific things. And then my second pregnancy, I felt more pregnant. I was further along. I was convinced everything was fine. And then I started bleeding on labor and delivery when I was the chief resident in charge of managing the entire labor floor. And that one was terrible, both physically and emotionally. And I remember going to my doctor after. And the thing that struck me is I knew this, and luckily this has changed, but at the time, recurrent pregnancy loss was defined as 3 pregnancy losses. So you couldn't get an evaluation until you've had 3. And now, for people listening, it's after 2 we recommend an evaluation. But I was told by my doctor that I need to just keep trying, and if you lose another pregnancy, then we'll do the evaluation. And that was so, disheartening to feel like I hadn't failed bad enough to warrant testing. I felt very dismissive. I brought up a bunch of questions about, am I running too much or tracking my cycle or diet? And it was all, none of that matters. Just keep trying. It's just bad luck. So we followed medical advice and kept trying. I lost my 3rd pregnancy, and then my 4th one, and now we're into fellowship. I had an ectopic pregnancy, or a tubal pregnancy. And in the same timeline, I was really interested and why some people were having an easier time and some people struggled like I did. I had an evaluation by this point and everything was normal. So we had an explained recurrent pregnancy loss. And I was told the next step for me medically was IVF, but I was the IVF fellow. So I needed to wait until it was a better time. So I kind of had this waiting time period. And I asked, well, what can I do to have a higher odds of IVF working? And I was told nothing. Just do IVF. None of it matters. And I just really didn't believe that, because at that point I was doing IVF and I saw some people's eggs and sperm were better than others, talked about egg quality and sperm quality. And we generally had accepted certain things in the medical world, like smoking cigarettes, for example, is associated with poor egg and sperm quality. So doesn't it make sense that there's other things as well? And to shorten this very long story, I advocated to do my research and fellowship, a year and a half as research. And most people study IVF because it's a controlled environment. And I really wanted to study fecundability, natural fertility. And I went to my fellowship director and said, look, I've spent time in a basic science lab. That's not what I want to do. I want answers to the questions I have that other women have. And luckily, I was at a place they were very supportive, but they did say, well, you need to get a master's in clinical research. So I did. And then I started studying vitamin levels, ovarian reserve, the luteal phase, cycle tracking, fertility awareness methods, endocrine disrupting chemicals. And those were the projects that I did all of my research on. And it led me kind of two different ways. One is to understand how it feels to be on the other side of the table, right? No question is worth dismissing. Every question needs acknowledgement because there's so much we don't know. At least trying to explain as a physician, like where your mind is, why this may or may not be applicable, and truly approaching medical care with something as important as growing a family with a shared decision-making mentality, right? Like I can explain things to you, you can understand, we should make this decision together. And the field tends to be just historically a little bit paternalistic. And all of this research I was doing really made me feel like, just because the perfect study hasn't been done doesn't mean something isn't true. And seeing inflammation and all of this literature across these different things. And yet at the time, and it's almost 15 years ago, in medicine, we specifically were talking about inflammation on the disease process, not really about it predating disease or what is chronic inflammation and how that can contribute negatively. But I really started to feel like they're all connected through this inflammation piece, and that's really important. And so started to personally decrease my own inflammation, trying to learn to be my own N of one, like listen to my body. What does it feel like to have inflammation and what can mitigate it? And we cleaned out our kitchen and we changed how we ate and, did all of these lifestyle things that I talk about a lot in the book now and to my patients. And we ended up getting pregnant and staying pregnant before ever needing IVF. And a lot of that was probably due to the fact that I noticed I felt just more inflamed when I ate gluten. I would have told you I just felt like fatigued, like icky, like nothing GI or like I would have thought classic celiac symptoms. But then, a decade later, I did get diagnosed with celiac disease. And, it wasn't a coincidence that cutting gluten out of my diet led to being able to get and stay pregnant for me. So it's something I'm really passionate about in how I educate just the public, how I educate patients. But my own story is really rooted in understanding that going through infertility is so challenging physically, emotionally, financially, and time, and that time variable of feeling left behind and doubting yourself, doubting your body, that even if we can't control the outcome, controlling the journey is really important. Feeling confident that you're making the decisions that you can, why you're making the choices that you're making, and not going to be in that position, which really was the nightest for me, even getting on social media, was sitting across from so many patients who said, had I only known this information, I would have done something different in the past.
Wow, thank you so much for sharing all of that with me. I think it's so inspiring, not just inspiring, it's empowering to know that you were able to take control of your own journey, do your research. And whilst you had to go through all of those challenges, now you're able to share so much of this information and help prevent so many other women and couples suffering, through similar scenarios. So thank you. Thank you for sharing that. I mean, there are so many different factors at play when it comes to fertility, and a lot of them are really silent fertility disruptors. One thing I loved hearing you talk about recently was insulin resistance as a silent fertility disruptor. So can you explain why insulin resistance matters so much for ovulation, for egg quality, and also implantation?
Oh, Ellie, absolutely. And we'll say, insulin resistance is one of the top drivers of chronic inflammation across the board. And so many patients, when I bring this up, will sit across from me and say, oh, I don't have diabetes, or diabetes isn't run in my family, so I don't need to worry about this. Yet insulin resistance is a big player. And so I love analogies. So here is my analogy to try to describe this. If we can think about what is happening in your body physiologically normal. So you eat food is broken down into glucose, and glucose is the fuel of the cell. And we're simplifying this process. But let's just say you have glucose in your bloodstream, and now your pancreas is going to release insulin. And I like to think about insulin as a salesman going to the door of the cell, knocks on the door, the cell opens the door, glucose can go in, salesman goes away. But insulin resistance is, what do you do when a salesman shows up at your door every day? What do? You're probably going to stop answering if he's there all the time. You're going to look out and say, I don't want that salesman. And That's what your cell starts to do when you start to develop insulin resistance. However, glucose still stays in your bloodstream. Your cell needs glucose, so it's hungry, even though it's not opening the door. It then starts to break down stored glucose, so you have even more glucose in your bloodstream. And now the pancreas releases more insulin. So now the salesman is banging on the door. Finally, you go and you answer it because you want to get rid of him, and glucose goes in. So it takes a higher insulin level in order to get the response of allowing glucose into the cell. But that high insulin is not benign. What it actually does is it causes you to distribute visceral fat, which is very inflammatory. It itself causes, this stress response within your body. But if we want to be really simplistic, it changes the ovary level, how the ovary responds to the normal signals. So FSH and LH from the brain. The ovarian response is changed to be more androgenic, makes more testosterone, doesn't respond the same in egg growth pathway. It actually changes inside the egg, what we call the egg quality, the chromosome competency, the mitochondrial function is influenced by that high insulin level. And in the brain, your brain, I think most people think your brain knows what's happening in your body. And that's not really the case. Your brain is waiting to be told what is happening in your body. If we think about all your different organs having walkie-talkies and communicating back and forth, and your hormones are the communication going back and forth. And we want to think about insulin resistance. It's like having static interference on the radio. So the brain, the hypothalamus, that control center, is now having a hard time hearing the signals coming in. So even if you are making some estrogen or progesterone, the brain's not interpreting them correctly, and therefore it's also sending out incorrect signals. So we want to look at your fertility, which is, a big word, and we'll simplify it to say normal hormonal function for the state of this. It impacts brain interpretation of signaling. It impacts ovarian response to hormones, ovarian response for ovulation, egg quality itself. And then it also impacts the ability of an embryo. So if all those things still do happen, but then for the embryo to implant, it impacts the placentation or the placenta growing in. So it's one of these variables that many of us are living with chronic inflammation due to insulin resistance, and we're not even quite aware of it. And there's a few different reasons why, but one is because typical screening for it is often done with like a hemoglobin A1C, which is an important test, but the reference ranges for it are really set at population-based levels, and they're quite high, meaning I see a lot of patients who do exhibit signs of insulin resistance, and they're in just high end of normal for a hemoglobin A1C. But if we could do a fasting insulin, we can actually see that their body is having to release a lot of insulin to have the same need. And so we really want to break this chain of events because unfortunately it starts to cycle on itself. And we think of some of the drivers, this comes from, the foods that we eat, eating ultra-processed food, the interval of food that we eat, chronic stress contributes to insulin resistance. And so chronic stress adds to the bucket, and so you have an abnormal cellular response, but you're also putting, more into the pot as well. So it really takes a multifaceted approach to start to change this process. It's not just add a medication on at the end. Yes, medications can be a part of a strategy, but we really have to change the input to your body to reprogram that cellular response.
It's so interesting. And we're going to come on to some practical tips of what we can actually do and be eating in order to support our insulin levels in our body, our blood sugar balance, things like that. But before we do, you're talking about inflammation. So for women listening who have been told they have PCOS, where does inflammation fit into that picture? And what do they often maybe misunderstand about their fertility?
That's a great question. And I find women with PCOS across the whole spectrum. I mean, some of the biggest myths is that PCOS is only associated with a certain body type, right? Because we know that women who are more overweight, some of their fat cells cause inflammation. They make estrogen. That estrogen confuses the brain, and they can develop a worsening of their PCOS symptoms or even a PCOS-like presentation. And with obesity rates, there's a lot of people who are overweight, and therefore we see an increased prevalence of PCOS. But I will see women of all body sizes who have PCOS, and in fact, many lean women have been told before, you don't have it because you're thin. So I think there's a lot of misunderstanding about what the disease is first. The way we diagnose the disease has its own problems, but it's a syndrome, and we diagnose it with 2 out of 3. One of those is irregular or absent periods. The second of those is having high androgens, either symptoms or labs. So a high testosterone level or acne would both meet that criteria. And the third is going to be a PCOS, a polycystic ovarian appearance on ultrasound, which is defined as having a lot of follicles, the volume of the ovaries, or even we're starting to use a high level of AMH, but essentially a lot of eggs. And you only need 2 out of the 3. So, Ellie, if you tell me right now you have irregular cycles and acne, I can go, boom, magic fairy wand, you have PCOS, even though it could be something different, right? But that is kind of a capture all approach. What is really happening that we also don't understand is that because of some of this process, we'll say having a high number of eggs and the miscommunication between the brain and the ovary, you have a lower threshold to develop that insulin resistance. And that's why so many people hear us saying PCOS is a metabolic disease. Your ovaries from birth have been programmed to respond differently, and they are more insulin, resistance prone. They're not going to have the same kind of threshold that somebody without PCOS can have. And then this all feeds back into that chronic inflammation. So I always tell patients PCOS is an inflammatory disease. That's what we are classifying it as. Trying to get to the, cure of it isn't quite that simple because a lot of it's due to how many eggs you're born with and how your cells have been programmed from before birth. But you can control it and learn to manage it. But it does take a multifaceted approach because of this metabolic thing. And so patients who are, just given a prescription for birth control, which is a option sometimes to treat some of the symptoms when it comes to abnormal bleeding or acne, it is not necessarily treating or curing PCOS. So many patients with PCOS present with symptoms. They don't ever get a formal diagnosis. Their doctor is given a prescription for birth control pill saying, hey, this will help. And it does. But then when they stop the pill later and they want to get pregnant, they have all these symptoms come back. Maybe they're even worse because now they're trying to get pregnant. They're paying attention and they think the pill messed something up. But in reality, the pill just took away years of opportunity to understand and manage the disease. And we're a little bit behind the 8 ball now. So I don't ever want to say the pill is bad. It can be a useful treatment strategy, but I do think it is bad that we have just given it so freely without explanation or diagnosis as to what's going on. And I've also had patients with PCOS tell me I was told I could never get pregnant. And that's almost never the case. What I always would say is, hey, you have PCOS, it's associated, with irregular cycles. It might be harder to ovulate and to get or to stay pregnant. When you're ready to be pregnant, we need to be more proactive and do a full fertility evaluation. And we might need ovulation induction a little bit earlier or to manage your insulin resistance. But it doesn't universally mean you can't get pregnant. But it also means that most people will need some level of help. So this idea that it doesn't impact your fertility or it does, patients are told both of these things. And then they're just really shocked when they're presented with reality.
Yeah, I love how clearly you break that down. I think that education is really the missing piece of the puzzle here. And, in so many cases, people, like you said, they'll come off the pill and they will be struggling and they won't know what to do. We know we should be consuming fermented foods for our gut health, but have you tried kimchi or sauerkraut? This episode is sponsored by The Cultured Collective, whose kimchi and sauerkraut are naturally fermented, unpasteurized, and tested for live cultures, as well as being a source of fiber. They've won awards for their flavor, so I'm not the only one who thinks they taste amazing. It's really easy to add a scoop of these real live foods to all kinds of meals. I love adding kimchi to the side of my eggs and topping avocado toast with sauerkraut. They're offering listeners of the Gut 360 podcast a huge 50% off their kimchi and sauerkraut, so head to the show notes to find out more. This episode is sponsored by IM8. As a nutritionist, I'm always talking about the importance of a 360-degree approach to health, supporting your gut, energy, immune system, and sleep consistently, not just when something feels off. That's why I've been using IM8 Daily Essentials as part of my morning routine. It's a comprehensive formula with 92 nutrient-rich ingredients, including probiotics, prebiotics, and postbiotics to support the gut, alongside key vitamins, minerals, and antioxidants to help fill in the gaps of modern living. It's not a replacement for a balanced diet, but it's a really convenient way to help support your foundations daily, especially when life feels busy. If you're looking for something simple to support your mind, body, and gut, check out IM8 Daily Essentials. Use the code GUT360 for a special discount and free welcome kit on your first order. Let's talk about the concept of trimester 0. So that's the months before conception when we can actually really make a difference to our fertility environment. So what does trimester 0, what does it mean? Why is it important? And also if someone is just trying to optimize their fertility naturally, whether they've got PCOS or not, before trying to conceive, where would you start without making it feel too overwhelming?
I love it. So trimester zero is this idea of what you do before you get pregnant matters. And it's really a concept for both men and women. And I like to think about it as, the 3-month time period. That's what a trimester normally is, but it can be longer, it can be shorter. But this idea, instead of when I was trying to get pregnant, Ellie, the idea was like, stop your birth control and just see what happens. Like that to me doesn't fit the narrative in a world where more people have infertility and women are waiting longer to get pregnant. Instead, we should say, hey, we want to get pregnancy and let's be proactive so that we have the highest chance of success. The concept here comes twofold. So it's important for both men and women. For men, the life cycle of a sperm is about 3 months. So it takes about 72 days for a sperm to be developed. Sperm are made every single second. They grow and develop across the testes, and then about 2 weeks to come out the ejaculatory system. So about a 90-day period, so 3 months. Sperm are so sensitive, they're made in such excess that it is great in a way because men can highly influence their environment. And yet, so often men are not given any instructions about anything at all. Sperm are very sensitive to inflammation, insulin resistance, heat, and toxins. So tips on this for men. Obviously, we want to avoid external heat to the testes, things like hot tubs, saunas, laptops, and lap. We want to eat a diet high in fibers, fruits, vegetables, antioxidants. We want to make sure we're not exposing ourselves to extra toxins, most notably nicotine, heavy alcohol, cannabis use, and then endocrine disruptors, especially some of those plastics that we see in the environment. We also want to be mindful of the fact that men can be taking exogenous testosterone. This is often prescribed by men's health clinics. Maybe there's a real problem, but when they're put on testosterone, it acts as male birth control and prevents the brain from sending out signals. So in a semen analysis, we're able to evaluate sperm count, sperm motility, sperm shape. It gives us a lot of information, but we know across the board, starting to focus on decreasing inflammation and these good healthy practices can give you the best sperm. And sperm quality is associated with pregnancy outcome. So, men who use cannabis, their partners have a higher rate of having a miscarriage. They have more fragmented DNA inside the head of the sperm. And even things as small as getting sleep, all the lifestyle factors that we decrease inflammation that I'll walk through. For women, it's a little bit more nuanced because our eggs are in our body our whole life. We're born with all the eggs we're ever going to have, and we lose them over time. I like to use the analogy of imagining that our eggs are stored in a vault inside our ovary. So every month, a group of eggs comes out of the vault, and then one of these eggs grows and ovulates, and the rest of them die. And then next month, we have another group. Well, what's happening, though, is as the eggs get closer to being the group line that gets sent out, they become more susceptible to the world around us. So they are impacted by wear and tear of time, the things that we do while they're in the vault. Let's think about them as in deep storage. But as they start to get to the surface or in line or coming out, they are more sensitive. And we know that this is going to be the first tiers 300 days before ovulation, but really they're the most sensitive in those 60 days prior. So this is a good marker too, or to say, hey, it's not too late, right? I often have women who say, oh my gosh, I heard smoking so bad, but I smoked in my younger years. So like, what am I to do about that now? We can still make a positive impact on our egg quality and our egg function by the decisions that we make right now. And it follows the same tenets that chronic inflammation is one of the top things that is influencing our egg quality, just like it is sperm quality. And this is often, sometimes it's from disease state, which you can't help, right? If you have endometriosis or PCOS. But in those patients, understanding and leveraging the lifestyle factors about what you can do becomes even more important. And I like this concept of your inflammatory burden. So you're exposed to inflammation every day. That is the world we live in. But every little decision you make, whether you realize it or not, can increase or decrease your inflammatory burden. So will you sleep? So if you don't get enough sleep, you're going to have increased inflammation. We know that. You're going to have, higher stress levels. You're not going to make hormones from your brain in the same way. You get fewer eggs per egg retrieval cycle for every hour sleep less you get. Men have lower testosterone and sperm count. So it worsens things. Similarly, if you get at least 7 or 7.5 hours of sleep, your inflammation goes down, right? So it's not just a net neutral or luxury or a good. It actually can drive that inflammatory burden in either direction. And that's true across the board for what I consider my 5 fertility, non-negotiables. And that's going to be sleep, managing stress, how we deal with exercise, what type of exercise we do, the foods we choose to eat, dietary choices, and avoidance of toxins. And these are the different categories that we make decisions every day that we should at least be making them from a place of knowledge. And it's not this all or nothing plan. but it's really trying to build resilience within your body, because your body has checks and balances. Like if you're exposed to inflammation, say you don't get sleep or you get sick, your burden can go up and your body can bring it back down. But when it's constantly dealing with a higher level, it is not able to take on those challenges. And that's when our normal hormone systems like ovulation or egg quality start to really be impacted because of that increased inflammatory burden.
I love the analogy that you use about the vault. And I actually want to start by diving into number 4 of your 5 fertility non-negotiables, which is diet. So I know that you originally studied nutrition. You were a nutrition major back in college. So I'd love to hear your perspective here. What does an anti-inflammatory way of eating actually look like for fertility without becoming overly restrictive or stressful?
Love it. And I'm going to give, kind of going through the categories, my general approach. But before I do any of that, I want to say 2 things. One is that we all respond different to diet. And we do, right? Our bodies are all wired a little bit different. Our gut microbiome is a little bit different. And all of that is totally fine. So the importance, especially for women, in learning to trust yourself and the symptoms and the red flags your body is giving you is really important, because many patients like myself have been dismissed at prior doctor's appointments, and you start to doubt yourself. And I hear things over and over like, that's just the way I am. I'm just more sensitive. I have a poor pain tolerance. This dismissal of our own symptoms because they have been dismissed. So a key to diet is to understand some of these basic principles we'll walk through, but then to allow yourself the agency to trust your body and modify as things are going. And so I think that that's something that's really important, is learning to trust your own body. And then number 2 is going to be certain things you might need to give yourself a trial off of and then reintroduce to see how your body tolerates it in that whole N of 1 experiment mentality. And I say those groups specifically are going to be if you have unexplained infertility, if you have recurrent pregnancy loss, if you're not getting pregnant. We want to kind of cast the net a little bit bigger. But across the board for diet, number 1 is we need more fiber in our diet. Fruits and vegetables, unlimited. They are so good for you. Eating the rainbow. We know from fertility-based studies, having 2 servings of fruits and vegetables at every meal, at least 6 a day, is going to give you the highest rate of success. So that is what, at least here in America, most people need to put more on their plate. It's kind of like an afterthought versus a primary substance.
Here in the UK too, I can tell you that much.
So fiber is so good for your gut microbiome. We have to remember that, fruits and vegetables and their fiber source feeds that microbiome environment of the gut, which is important for gut integrity. And I like to think of it as that first line defense against inflammation. If your gut microbiome is not healthy, you're letting more into your body, versus if that gut microbiome is really nice and healthy, in addition to the fact that it's hormonally active, important in estrogen metabolism. So it's very important for your health. The reason why that becomes really essential to understand is that fertility-based studies show that replacing every serving of animal-based protein with a plant-based protein improves ovulation and hormone levels and fertility. That doesn't mean you have to avoid all animal products if you don't want to, but most people only leverage animal-based protein sources, and they're not leveraging plant-based ones at all, which have added benefits of having fiber and other nutrients in them. So things like tofu, legumes, we want to make sure that we're incorporating some. And I try to challenge my patients that even if they like to eat meat, for example, that, a couple meals a day, they are looking at plant-based protein sources and learning how to incorporate those or give them a try, because so often we just eat how we were brought up and what is comfortable to us. That's what we order and that's what we cook and eat. When it comes to animal-based protein sources, not all are created equal. There's also, as you know, so much diversity in studies and how they're studying them and what the endpoints are. And red meat, for example, is always a hot topic and gets grouped in a category. But we can say the difference in a fast food hamburger and a grass-fed piece of steak is different. But in general, red meat specifically looks to be the most harmful to fertility outcomes. We see worsening stage of endometriosis, worse sperm parameters, poor embryo development with IVF, and poor IVF outcomes with increased servings of red meat. And these studies tend to quartile your food. So everybody puts in how much they eat. People who had the highest amount compared to the lowest amount is what they're looking at. So again, it doesn't mean it's universally bad, but we want to make sure we're having it in moderation and paying attention to the source. I usually have my patients say like red meat once a week. And then we're leveraging, some of those other, especially fish, so high in omega-3 fatty acids as a really healthy protein source, in addition to eggs, which have a lot of choline and other vitamins in them that can be really a nice protein-based source. From there, I think there's also this like low fat craze, and hopefully people are starting to shift over it. But cholesterol is the backbone for steroid hormone production. So those healthy fats, olive oil, nuts, avocados, we shouldn't hesitate from those. Yes, the artificial fats and the saturated fats can be less beneficial in excess. Saturated fat comes from animal products, but we're really most concerned about some of the trans fats and the things that are really found in those ultra processed foods. So in the ultra processed food category, we want to try to avoid them. They really don't have any nutritional benefit. They increase inflammation directly, and they really don't have a place in a healthy diet on the regular. The other categories are, grains, which we see a lot of refined carbohydrate, usage. We really would love to see more complex carbs chosen that have a lower glycemic index. And dairy. And when you consume dairy, we'd rather you have full fat dairy versus some of the skim or the processed dairy that doesn't have as much nutritional value. Those kind of are in a category on their own because people tend to have more food sensitivities to them. So if you're struggling, unexplained, bad IVF outcomes, I'll sometimes remove those from the diet, give your body a little reset, and then add it back in so you can see if you have sensitivity to it or not. And if you don't, great. But if you do, then it's probably going to be best for you to avoid it if it's a food that's causing inflammation with you. And again, like these are just guiding principles, and how I explain it to my patients is, hey, you want to cultivate your eating habits so you don't think about it over and over again. We don't want to stress about it. But if you make the majority of your choices from diet from a place that's going to be high in fiber, fruits, vegetables, good, healthy nutrients, those building blocks for your body, then it's no big deal for you to have a piece of cake on your birthday. Your body can handle that and go back to normal. When we're constantly having these really processed foods, these things that are not nutritious for us, our body shifts how it functions, our gut microbiome shifts, and it becomes a cycle that is very hard to break.
Wow, this is gold. I mean, there's so much practical things that we can be doing. I recently completed a qualification in fertility nutrition. When I told some of my friends and family about it, some people said, "What do you mean? There's a link between what you eat and getting pregnant." And I can't believe that so many people don't know about this. We need more people to understand that our diet and our lifestyle can really, really influence our fertility in so many ways. So thank you for sharing all of that. I think something else that there's a lot of confusion around is egg freezing. Do you think that women should be thinking more proactively about egg freezing? Is it truly an insurance policy? What's your take?
Egg freezing has really changed the game for a lot of women, but there's a lot of misconceptions about it. When you freeze your eggs, we're taking 1 month's group of eggs that are outside the vault and we're trying to get them all to grow. I always like to remind people that every month you have a group of eggs coming out of the vault. I'm not influencing how many come out of the vault. I can't tap into the vault. Trust me, if I could tap into the vault, it would change how we do IVF, because when we do IVF or egg freezing, I can only get what's outside the vault to grow. This means that those eggs were destined to die, and we're just trying to get them to live. So the number one misconception I see, just to state it out front, is that if you freeze your eggs, we are going to remove eggs and you'll go into menopause earlier because we're decreasing your egg count. And that's not true at all. We're just trying to get what your body would have had die that month to grow. So I think that's important to frame it. In the same breath, it's absolutely not a guarantee. It is not an insurance policy. An insurance policy always pays off, right? If you have car insurance and you wreck your car insurance will help. This is an investment. It's like putting your money into the stock market. It will probably work out for you, and especially if you're doing it smartly, if you understand what you're doing. But there's risk involved, and we do not know the outcome until you go to use them. And that's how the stock market is too. The ROI on that investment is based on the future, and we can make a lot of presumptions about what that will be that at the end of the day, we don't know until we get there. So it's really important to frame that from a smart place. I think, though, there's no denying that egg freezing can help women in multiple levels. One is that it does allow you to have an opportunity at a later age you would not have. It can help you grow your family to your desired size. It can be more cost effective to try to get pregnant, especially if you are waiting to start your family. From studies, The ideal age to freeze your eggs, if you know you want a kid one day and you're not ready to try, is going to be 32, 33. Does that mean everybody over that will have a hard time getting pregnant? No. But what those studies are looking at is the odds that you will need them and the money that you spent being worth it. And cost is not always the most important driver here. From a social standpoint, I think as women start to get to their mid 30s, so from that 32, 35, if you are not partnered with somebody yet, there tends to start to become some external pressure on that relationship. And my patients who have frozen their eggs, many of them have come back to use them with this partner later in life, some of them not. But they have said just having eggs in the freezer makes them in a better mental place to evaluate the relationship for what it is and not feel like I really need this to work out because I really want to have kids one day, right? Putting a future goal dependent on a person and a timeline is a lot of pressure. So instead saying, hey, I have these frozen eggs, I can see if this is really who I want to be my life partner and explore that. And then I say, when you do find that person, or you're ready to do this without a person, now come back to me and we can evaluate, your whole fertility, make a game plan. Do you use the eggs from the beginning? Do you try to get pregnant naturally? Do we do some combined approach? There's so many different ways we can get from point A to point B, but freezing eggs, if you know having kids is a life goal for you, or you suspect that it is, does keep a door of opportunity open. Yes, it's expensive. It's not accessible to everybody, but there's nothing to be lost for learning about the process and getting your own egg count checked. If it is something you're curious about, the time to explore it is now.
I love the stock market analogy. And I definitely think there's no harm in having an evaluation, looking at things like, going to a fertility clinic and just keeping your options open. I definitely think, like you said, taking the pressure off can be a game changer. Another thing I wanted to ask you about is male fertility, because we still don't talk enough about male fertility. What do you think are the most important things that couples should know about sperm health before trying to conceive?
Sperm can be very influenced, 90-day sperm cycle. So I think cannabis is the number one thing I'm seeing in clinical practice that many men will say, well, it's better than drinking or smoking. So they have this idea that if they're otherwise healthy, it's fine. And that's not really the case. It is probably one of the most detrimental things. Also, a sperm analysis is telling us a lot of information, but not everything. There is an additional test called a DNA sperm fragmentation, where we look at the DNA inside the head of the sperm, especially if we're having reproductive outcomes that don't match with the testing that we're getting back. But sperm is important even if you're doing IVF. We can tell in IVF if the embryo stopped developing, when they stop developing, if there's this male factor that's coming on board. So I also see patients sometimes say like, oh, we're doing IVF, so it'll be fine. I don't have to worry about this. The medical system is made to treat the population and not the individual. And that's an important concept because right now, the definition of infertility is trying to get pregnant for a year without success, and then we'll do testing and try to figure out what is going on. But by definition, that does make you fail before you get there and doesn't serve a lot of people. I think a semen analysis specifically doesn't tend to cost very much. There's many different options you can utilize to do that. And it's giving you information ahead of time, especially when we know it can take months to remedy a sperm count. There's an evaluation that has to be done, or we could change behavior. Some of the hardest cases I've seen are couples who've tried a year or two and then had a semen analysis and there was no sperm. And suddenly they feel like all that time was wasted because there was a 0% chance of pregnancy. And their family has to look a lot different than they were thinking about. Either have to do IVF, see if medication can get sperm back, see if we could do a sperm extraction, or consider donor sperm. And that's all really different than tracking cycles and timing intercourse. So I think that in my perfect world, I'd love for everybody to get a semen analysis before you want to be pregnant, because it's going to give you such actionable information that you need sperm to conceive. So you just have to ask for it. You can also call a fertility clinic. There are some online options. So that's something I don't think people think about enough. And then the importance of men's health for conception and, placental health. So pregnancy health, the health of the baby, is something that isn't really discussed as much. We're starting to see a better trend towards talking about that.
Yeah, definitely. And just to add my 2 cents here as a nutritionist as well, there's plenty of things that men can be doing. For example, selenium is particularly important for sperm health. So 2 Brazil nuts a day is your selenium intake. You might want to consider a male prenatal as well as a female prenatal, not necessarily in all cases, but if there are real nutrient gaps in your diet, perhaps something like omega-3 supplementation if you're not eating oily fish a few times a week, things like that. So there's lots we can do. Before we move into the quickfire round, I want to finish by asking you about toxins and environmental exposures. I know we touched on this, but this is something that both of us care deeply about. So, which exposures matter most, and what are some simple swaps that are actually worth making?
This is one of the categories that feels so overwhelming to people because the world is so toxic, toxins are everywhere, and people will often say, well, if I can't fix everything, I'm not going to just worry about it and put it out of mind. But the truth is we've got, plethora of data about how impactful toxins can be to both hormone production and egg and sperm quality. So the things that are most important are the things that you are exposed to the very most. Typically, this is going to be the things in your kitchen, the foods you eat, how you cook, what you eat off of. So, the products in your kitchen, how your food is packaged, also your water and the water you drink, and then the beauty and bath products that you're putting on your body. So, I have to think about the things that go on or in your body as your starting place because their impact is often doubled or more because of how you're exposed to them. I will say in the book, I walk through how you approach the kitchen, how you approach the bathroom, and what you should think about and look for in products because it can feel overwhelming. It's helpful to have a roadmap of what to do. But again, it's not something to cause extra stress about. But if we decrease our daily exposures and things that we do every day, and we're being very mindful about them, and we've cultivated a home, for example, that has less toxins, then it's not that big of a deal if we are exposed to a fragrance at a friend's house or at a restaurant or, places where we don't control the toxin exposure when we eat out or we go other places. So we just want to be making sure that we make the majority of our decisions from a place that's really mindful. Things like nonstick cookware or Teflon that can be replaced with stainless steel. Obviously, no plastic in the kitchen, making sure that we're looking at especially the things we have that are hot because heating them causes chemicals to leach into that liquid and then we drink it. So coffee is going to be one of those biggest things there. So if you go to Starbucks and you get a coffee, can you transfer that into a mug that, is better for you, even if you get something maybe in a less green container, something that potentially has toxins in it? You make the best you can at different time points. So just transfer that to a different cup. If you order out food from to go, well, we can't control the toxins of the food. We can try to eat, order the best we can, order from better places, but don't eat out of the to-go container, right? Put that immediately onto another plate so we don't get the toxins from that to-go container leaching into our food longer. So a lot of this is just making smarter decisions when we are faced with the opportunity, but you can't make decisions on data you don't know. So we have to start by, educating us about where those secret hidden sources are.
Definitely. I think it's really important to think about the things that you're doing most often. So even things like the hand soap that you're washing your hands with, your washing up liquid that you keep by the sink. If you are, having like healthy frozen ready meals, don't microwave it in the packaging that it comes in. Transfer it to a bowl and then, obviously not a plastic one, and then put that in the microwave if that's what you're doing. Little swaps like that. That's so useful, so valuable. Thank you so much, Dr. Natalie. We finished each guest episode with a quick fire round. So are you ready?
Let's do it.
What is something that seems healthy but often backfires for your health?
Oh, unscented versus fragrance free. So, unscented in your product can mean that there's no visible odor, but a fragrance can be neutralized with another toxic chemical versus fragrance free is there's no added fragrance at all.
That is so interesting. I'm sure a lot of people didn't know that. What's one habit that you see clients struggle with the most?
Sleep, and it's probably the most important one. Really making sure that we're prioritizing a good sleep environment, making the room cold, dark, a sound machine, a sleep mask, taking melatonin beforehand, and screens, I think, are the number one offender. Trying to put your screens further away from your bed.
Definitely. What's your go-to breakfast on busy days?
Oh, a smoothie with protein powder and creatine, lots of veggies, and almond milk in it.
That sounds delicious. What's your favorite gut-friendly food?
Um, The problem for me is that I know I'm supposed to say like fermented foods because they're so good for your gut, but I don't tend to love them so much. So I'm a huge, fruit and veggie eater when it comes to it. And so like cruciferous vegetables like broccoli and cauliflower tend to be my favorite go-to, especially incorporating them in all different ways. So, cooking them, but also raw is one of the ways like I love to just get broccoli and, dip it in hummus and eat that.
Cruciferous vegetables are amazing for your gut health and your hormone health too. What did you personally get wrong early on in your career?
Oh, a lot of things. I mean, I think one of them was not, trying to please others and learning to listen to, I'm passionate about or what's important to me. And I think that so many of us, especially in medicine, are get where we are because we are pleasers in a way. But I think that really learning to believe, my gut, I made a career pivot from emergency medicine to OBGYN to fertility, absolutely was the right thing for me. But everybody told me I was making the wrong decision, and having that moment of being very clear, like, no, this is right for me. I trust myself. That was hard.
Yeah, it is hard, but it's amazing that you did trust yourself, listen to your gut, and look where it's taken you.
I was like, look at us now, right?
What is one healthy habit that you're still working on?
Oh, goodness. Probably managing stress. I would say I'm much better than I was in my younger years, but it is still something that I feel like I've got to actively incorporate into my day because, especially in this season of life where I have so much going on with the book, it's very easy to put, managing stress at the bottom or get really overwhelmed with everything that's on my plate. And so taking one day at a time, but carving in some time for me, I'm still working on it.
I think that is such a common one, more than we realize. Let's finish this round with a few fun ones. Coffee or matcha?
Coffee, although I do love both.
Favorite coffee shop?
Oh, there is a local coffee shop to me, that I really love, and it's like, hold on, I can't even think of the name of it, even though I can picture it. Oh, it's called Genuine Joe's, and it's down the street from where my husband and I used to live in our first house together, and so I still love to drive by there in Austin and go.
Lovely. Overnight oats or eggs on toast?
Overnight oats, but I'm biased because I'm celiac, so, gluten-free toast is not the same.
That's true. If you could only do one type of exercise for the rest of your life, what would it be?
Lifting weights.
Amazing. And lastly, what is one word that you associate with a healthy gut?
Fiber.
So important. Thank you so much, Dr. Natalie, for being a guest on the Gut 360 podcast. If someone wants to learn more about what you do, where can they find you and where is the best place to buy your book?
Absolutely. So the book is The Fertility Formula, and it is available everywhere the books are sold. So you can go to your favorite bookstore or get it online. And I'm online at Natalie Crawford, MD, and you can find out more about me there.
Amazing. Thanks again, Dr. Natalie, for your time. And thank you guys for listening to the final episode of this season of the Gut 360 podcast. We all know someone who is trying to conceive or planning to start a family one day in the future. So why not send them this episode to listen to? I also just want to take this opportunity to say thank you so much to each and every one of you for coming back week after week to listen. And it would mean so much if you could leave a 5-star review wherever you're listening. In the meantime, come connect with me on Instagram at Ellie Breacher Nutrition. Drop me a DM to let me know what you thought of today's episode and have a wonderful rest of your week.